Just wanted to give you a little idea about who is in attendance from what sectors. So we have a lot of lollipops up here with numbers on them, everything from folks who identified themselves as in the business sector, healthcare. You can see that healthcare, community organizations, and government represent the largest single groups of organizations that are represented here. But we do have folks from schools and early childhood. We have folks from the behavioral health and mental health community, youth-focused organizations, and those that are focused on older adults. And of course, we have public health included in this. As the director of public health, a lot of my team is here today to be certain that we share with you data about how we're doing. We want to move from data into conversation, and some of those conversations will be at a higher level and then diving deeper in our breakout sessions, and eventually this is all to lead to action. We don't want to sit around only talking about data. It's really important to know our communities and what they are telling us, the members of our community. So we want to begin to share that with you today. But ultimately, this is about how do we work together to be certain that we can make Weld County the healthiest spot in the healthiest state. We want to be certain that this part of Colorado is growing very quickly. We're attracting many new people, and we want to be sure that we can continue to make health a priority here in northern Colorado, and we're going to need to work together to do that. So just a little bit to frame some of the conversations. This is a health paradox in the United States about what is it that we know contributes to health. And you've got some things on your tables. There's some cards there that begin to let us share together about what we know affects health. It's not just health care. And so it's intentional that we have people who are going to talk beyond straight health care. But we know that in order to have good health today, there are a lot of other things that affect our ability to achieve and sustain health. And then there's the conversation that has to happen about where do we make our investments. And together, as we move forward over the next couple of months and planning what we do here in northern Colorado, we're going to want to talk about what kind of resources do we collectively bring to this issue and this challenge about generating and sustaining health in our communities. Because without that, we don't have thriving economies or thriving communities. And so we'll have to confront this paradox as we move through our conversations today, if not directly over time. What we do know is that this is what contributes to health. You can see that the largest areas are lifestyle and behaviors. And it's not the first time that any of us have heard that. We all know how important it is about what the choices are that we make and what it means to our own health. We also know that the physical and social environment is increasingly recognized as being very important. And one of the things that we find in people who really enjoy Colorado is the physical environment that we have available to us. We have so many days of sunshine. We want to be outside. We've got great weather most of the time. And people talk to us about wanting trails. They want places to walk. They want to hike. They want to get outside. They want to be able to do things with their families. And we know what that does to health, to the health of their bodies, but also to their minds and to the cohesion of communities when we have a built environment that really is something that we can be proud of and that is contributing to health. For many of us, I'm trained first as a physician, and when I look at this little wheel, there are times in which I have a little pang of, what happened to healthcare? We're that little part down on the wheel. What we know, though, is that healthcare touches many more of these other places and is influenced by these other things around the wheel. So even though it may look like what we directly contribute to health, outcomes is sort of small. It is dependent on all of these others, and so we hold those dear to us too in healthcare and those of us who work as clinicians. And then lastly, genetics, and every day we learn about new inroads into being able to look at the genetic side of the risks that we face that prevent us from achieving good health. So one other thing, since we have a focus on, what is it to be a business today? What are the challenges directly related to the health of our communities? And here's a little tidbit. 4 in 10 Weld County working age adults in the workforce have one or more chronic conditions. And that's an interesting challenge for us as employers. It may not be that we're directly delivering health care, but our workforce is affected by that. And how they feel and their ability to work and to be productive and to have the gainful employment that they want and for our companies to do well, we've got to begin to look at what are we able to do collectively to lower that burden on our employees so that they can be healthier. There are some top 10 takeaways you're going to hear over the course of the day. I don't have time to go into all of these today, but our overall health status of adults in Weld County, their health is sort of mixed. We do know that we have more folks on health insurance than we've ever had before. We still see cost and scheduling barriers as a key part of what is keeping people from getting access to health care. We know that people are engaging in healthy behaviors, but there's still room for improvement. So we're going to share that healthy behavior part of the wheel, people are doing that. People are excited about it, but there's more that we can do to make it easier for them to do that and to be successful at it. Residents in Weld County are not immune to mental health conditions, and we have to be aware of that and look at what we're doing collectively to address that. We do have folks who take part in risky behaviors, whether that's smoking or drinking, and you'll see some more data later about just how many of folks in Weld County are doing things like binge drinking. We also have about 10% of our residents that use marijuana. I don't think any of you have to know that distracted drivers is a huge problem. Lots of technology is right by our side, and we're constantly wanting to access it while we're in our vehicles. And then health status varies by where we live and by our income and by our education levels, and we need to be aware of that together about what does that mean. Is everybody achieving health? Is it the same reach for everybody to get to health, or is it a bigger reach? Do some people need a hand up in order to be able to get to that healthy status? And then we know that we hear from our residents of Weld County that the environment matters around them, especially here in Colorado, where they very much cherish the environment and the great outdoors that we have here. So we'll come back to these a little bit more. I do want to give one last shout out before we move on. We've got a great panel lined up for you today and a great speaker. I really want to thank those of you who are elected officials or represent elected officials. Policy is another important part, and so many times we turn to our elected officials to help us have the kinds of policies in our communities and in our state that will help us achieve health. And so if you are an elected official or represent an elected official, if you could just raise your hand for us, because we'd like to thank you for being here today. Thank you very much for being with us today. You'll also be hearing more over the course of the day about a dashboard that we're using here in Northern Colorado to report on what we're doing, to lay out strategy and to report progress to it, because we know how important it is to track what we're doing. Otherwise, we don't know that we're getting to our goal. So we want to really engage in conversation today about how health is everyone's business. And we are so fortunate to kick us off this morning to have Margot Karsten here. She is the Chief Executive Officer for Banner Health Northern Colorado. To minimize how much time we take introducing everybody by reading their bios are on your table. So we're going to basically say, we have this wonderful person here representing themselves and their organization, and we get to start off with somebody who is making a huge impact in Northern Colorado with the work that Banner Health is doing. So please join me in welcoming Margot Karsten to the podium.
I always thought it would be fun if Meg Ryan would show up, because how funny would that be to get your attention? Is that really Margot? No, Kevin, it's not. It's who I want to be. So I've been in Colorado for 20 years, and before we were asked to speak, we got assigned questions. So I'm going to go with the hardest first and then go with the lightest. So one of them was about how do you create work-life balance? And because there's people in the audience that know me, I have to be truthful. I don't think balance exists in this work. And I think it's a personal choice. So I talk to my kids a lot about it. I'd say 15 years ago, I was a crazy workaholic and I ruined all my relationships. And I missed every single lacrosse game that my son played in middle school. And I decided after I stepped out of this work for a while and therapy for 2 years, literally, is you know what, I'm over it. I have nieces that watch me to be a role model. People look at me as a working mom outside the house, and I wasn't a good role model. And so what I've intentionally decided to do is no emails on weekends. I flip my phone over most times except for this morning at this meeting, so I wouldn't be late for this meeting. How do you be present? That's how I equate balance. How do you show up every day, and who's ever in front of you, I'm in. I'm looking at your eyes, my phone is over, and I'm gonna be yours for as long as we're together. And I've taught my daughter to be like this anthropologist. So we go through the airport together, and I said, Em, let's watch. And in restaurants, how many are really having conversation, Emmers? And she's 14, and we fail as a society, and I worry about that. And so for me, balance is let's not do emails. Kevin would remember, he worked with me. We did email delete, and I think the organization almost went crazy, if he remembers this. So what that looked like is if we went on vacation, we deleted every inbox email. It was crazy. And we learned that the control freaks went crazier because they couldn't get a hold of us. But I thought, in the 1990s, we didn't have email. And so I think as leaders, leadership is a gift. And how are we role modeling that? So my other approach to balance is finding joy in the moment. And so I always tell my daughter who's in high school, which I'll talk to about what health looks to me from her lens in a minute, is let's go find joy today. And when we get back home, let's talk about that. And last week, to be honest, the only joy I could give her is Starbucks has the holiday glasses out. And you can call her own. And so it really helped me understand this is heavy work, you guys. If you're in healthcare or you're in industry, this work can be really heavy. And so my work as a leader at Banner is how do you show up every day being present, looking for joy, and leading with heart. And I just talked to a leader who is awesome in our critical care unit. And I said, Julia, when you lose that, your emotional connection with your staff, then I'm going to have a conversation and telling you got to find different work, my friend. Because when she cries with her employees and her patients and families, that's balance to me. That means she doesn't have a hardened heart. She's showing up every day doing the real hard emotional work, and we're better because of it. So I always tell my nieces, I don't know if there is balance. I think you have to define it. Last week I'd give myself an F. I think what's symbolic is now I have 2 coaches. One is a life coach who makes me exercise and eat right, and I can afford to do that, so I feel just grateful. And the other one, Banner gives a leadership coach, which I've used forever. So if you're out of balance, I think what has helped me is for 20, 30 years I've had a coach. And in every organization I go in, I offer coaching as an intervention. And some of my team are like, are we in trouble? Is that why you need a coach for me? No, they're like a vitamin. They keep us true to our values. In these jobs, it's very true, you get very lonely. I would guess Marilyn and Kevin and I would agree there's no one to talk to in these roles. And so because of that, I use a coach. It's a safe, neutral party that keeps me true to my values. So what does that look like? Yesterday I had my coaching call, and he's like, could you just take a breath? I feel like you're like, ah. I'm like, okay, yeah, I haven't taken a deep breath all day, and it's 12:30. So that's kind of how basic I am. I look for joy. I try to be present. I try to flip over my phone. And I think really hard, when have I laughed last? Because when I left PVH, I was burnt out. I wasn't showing up as my best self as a leader, and I didn't find joy anymore. And when your son tells you, you missed every single game of mine, there's no do-overs. So what I try to do in our environment, there was a couple questions. How do you promote health in your environment? It's having a conversation with a physician who was proud that he missed his daughter's tennis game because he had a meeting with me. I said, you give me your wife's phone number right now because that's not going to happen again. So I think as leaders, if we can invest in our people and help them do meaningful work outside of work, they're going to show up their best selves. And so that's the work Banner's doing. We rolled out a new mission statement, and it's making healthcare easier so life can be better. And there are hard conversations right now in our culture because we're not perfect. And so when I had town hall meetings, I had a very courageous employee raise her hand and said, you really think you're living that? I'm like, I know, right? Tell me more about that. And she said, it's not easy around here. It's not easy to do work. I said, I know. This is our mission. And we're not living it yet. So you're going to help me figure out how we as leaders can help you as staff make it easy so you can do your work so life is better for you and then it's better for the community we serve. So I'd give us a D, to be honest, on our work in Banner internally to making it easy for our employees and physicians to do their work. The good news is I'd give us an A on the openness and the listening and being able to say, okay, we have Cerner as an electronic medical record. It's not great. But if we can make it better, that's as good as I got for you. It will never go away. So from a health perspective, I do a comprehensive look. That's why I actually like that slide. I think it is about your well-being, your choices, and how do you make that easy for our employees. So going forward, what I want to do is we have a really good employee wellness program, but we do a lot. I don't know if we impact. And so what I mean by that is I asked, okay, you did a stress assessment on me, like we do a health risk assessment. How stressed am I? Then this year when I take it again, if it didn't get better, well, I don't think our interventions worked, or I wasn't accountable to attend the yoga classes that we offer. So we do a lot in Banner for our own staff. I don't know if we've measured the outcomes. And so I appreciate being on the United Way board here in Weld County, because the whole focus is going to be on outcomes versus doing. You have to connect them. And so going forward in my tenure at Banner, what I want to work on is, as we do assessments for our employees, let's measure the impact it has. So offering yoga classes, did it reduce stress? Checking my HDL, which is my cholesterol level, and then having an open fitness center. Did I use it? If not, why not? And if I did it lower my cholesterol numbers? That's the work. And when I looked with Dr. Wallace on the slide just now, that's our work as a community. We can do a lot, but how are we measuring our effectiveness? So if you roll that out, my vision of my role in Banner for Weld County Impact is, I hope to be here 10, 15 years. I'm 55, and I feel like I have 10 good years yet in me, I hope. And I hope I always show up with joy and commitment. And what that might look like then is, how did I impact the health of the community? We will always compete in a healthy manner with UCH. We are blessed to have two awesome healthcare organizations. So market share, always a good priority, but it's not going to be my lead priority. My success would be that Deirdre Pilch, our superintendent, after 10 years of this work, would come up to me and say, we haven't had one suicide, Margot, since you've been here. We haven't had one person try to cut themselves. Because with your help, we create a resilience program for our elementary school and middle school students, that they feel good inside, and because of that, they're not doing harmful things to themselves. Because I always tell my daughter, who's high risk for suicide, you know what, buddy, when somebody takes their life, they might have had the cure for cancer and we'll never know. And so for me, my measure is absolutely compete, but I'm going to do that lovingly. I'm going to hug Kevin and Marilyn every time I see them, because I don't think competitors hate each other. I think we compete on quality, cost, and care. And when there's intersection of collaboration like behavioral health, we need to step in that space together. I think the other outcomes I want to be proud of in the next 5-10 years in my leadership role is, between UCH and us, we have the highest cancer screening in the world, actually, because we pushed each other to get screening so accessible and so inexpensive that we've extended people's lives, because it's so easy to get your mammogram and your colonoscopy and you're done already. So for me, it's behavioral health. It's how do we work together in this community to make you healthier. And always, when you get tucked into my bed at NCMC, you're going to give awesome care. But I want to get ahead of you. I don't want you tucked into bed. So our approach is a little different. We're going to come out to you and try to keep you healthy, so we don't need beds in NCMC. We want to meet you where you are, make healthcare easier so your life is better, that we go away. Our bed use is minimal, but your health demand is better, and the outcomes is lower behavioral health issues, healthier lifestyles, and then my work is done. And so you'll know when I retire, when we've had no suicides. Our health screenings are best in class in the country. And then I'll say to Kevin, buddy, I'm done. I'm going to go enjoy life. Till then, game on, people. So with that, I'm done. Thanks, timekeeper. So my job is easy. I get to moderate, and I was teasing Marilyn, maybe I should just change up the questions. I have the power of the mic. How funny would that be? But we're not going to create stress. See, that would have created stress. So I'm going to tend to the agenda, and we're going to start with our United Way leader. So Janine, talk a little bit about United Way, and then specifically address the question you were asked. So we modified questions, so I'm going to give them the liberty to just explain what is the work in front of you, and what was the question we asked, and what was your response?
I think I have to bring this here. Can you hear me? It said, About that, right. Great. Good morning, everyone. Thank you, Margot. So United Way of Weld County, our tagline is that we fight for the education, financial stability, and health of everyone in our community. And so we've been having a lot of discussions about the health part of that, and we've not come to any final conclusions, but here's what we know. Growing evidence says that 40% of a person's health is determined by social determinants. And Mark touched on that. And so that means, what are your living conditions? Do you have a home? What is the physical environment that you're in? Also, your education level. Kind of how that fits, what's your income level? And so we're beginning to see when our priorities are indeed education, financial stability, and health, they are really all interrelated. And so we are beginning to wrap, our arms around that. Many of you know that we're on a path to a more collective impact model, and we're very excited about that. We have several initiatives that have been going on for years related to bringing the community together to work on these problems together. And we've moved to outcome measurement. We're a proud sponsor and participant in the Thriving Weld dashboard because we do believe that it's not about activities, it's not even about the numbers, it's about the outcomes. And we all need to work towards getting better outcomes because we've got to change to do it right. And so that's key. I always think of things with the end in mind first. Where do we want to be? And we want healthy families and we want a healthy community. And so when I even think about a project or maybe an event that we're holding or something, I always think of the end in mind first. And so if we step back, we kind of like go backwards in that, well then where do we begin? And so for us, it begins in early childhood. And so that is essential. It's important to give children a good start in life. And that means emotional, physical, social well-being for all children in our community. And then we know that in reality, being financially stable is so important. And we know that education is also important. So the question that I was asked was, what can employers do to promote health amongst their employees and in our community? Number one, look at whether or not you're a family-friendly workplace. What are indeed the opportunities that the people that work for you, what are the supports that they have to be able to assure that their family is whole? And that is all the way from being able to have time off to go to a parent-teacher conference. It's all the way from being able to perhaps provide childcare benefits. Childcare is very expensive and very, very important. And so it is very, very important that in Weld County, we have good choices for parents to choose quality childcare. Offering programs, as Mark said, opportunity to exercise during the middle of the day, to do all those things that make you kind of a health promotion and a family-friendly workplace. Volunteering. Offering programs that, the bottom line is that research is showing that volunteering is good for our emotional and physical health. And so volunteering and encouraging that your people get engaged in the community because they will benefit from that as will the community ultimately. Speaking up, promoting education. Congratulations on 3A and to all the organizations And I think if Deidre Pilch were here, and I know Rhonda Solis is here, and some other folks, we've got to speak up for the things that we know are absolutely essential to get children off to a good start. And so standing up, 3A was not possible without multiple partners coming together. The chamber, nonprofit organizations, private businesses, lots of people that came together to make that happen. That is really important, because the reality is that the tie between education and health is very, very clear. And so the higher your education, the reality is the healthier you are. And that then wraps around because you're more economically stable, and it really is all interconnected. So for businesses and organizations to support the public policy, that is really, really important to assure that we're moving forward. Investing and financially supporting programs that aren't just the, kind of organization that's kind of the end of the day, but those that are really getting outcomes and results, and holding those organizations accountable for indeed getting results. So investing not only financially, but your intelligence. Because in the nonprofit world, we cannot do this work without the business intelligence to help us move forward. So I would say that is definitely another. Understanding, and I think this is key, that there is no silver bullet. There is no quick fix. This is hard work, and to really get us where we want to be, that end result of healthy families, a healthy community, it takes investing for the long haul. And so it's that real understanding and patience and hanging in there for that hard work. And understanding that we have to do this together. Being collective about that, and assuring that all organizations are coming together to figure out how we make this happen. Here's what we know. A family can live across the street from the best medical clinic. They can be able to walk in and access that any day. But if we've got hungry children in that household, if we've got a chance that there's eviction is going to happen any day, if we've got parents that are working 2 and 3 jobs, if we've got significant stress and emotional concern in that household, then their chances for being a healthy family doesn't exist, even when the medical clinic is across the street. So I guess my message would be that that's certainly what our organization, and we believe our partners are working on together, is that 40%. And that's so important to make sure that we move forward. And we can't do it alone. We do need employers, organizations, our hospitals, lots of folks to come together, our faith-based organizations to come together.
So my job will be then awesome, and how can you integrate what you just said? So I'll give you a couple examples. In volunteering, we decided we're going to let our leaders decide and work with Weld County and their tutoring. So our COO did it on Monday. She read with first graders, and it's going to be a win, to your point, in that if we can help educate our young children in Weld County, and our leaders are doing it at Banner Health, their enjoyment in their work is going to go up, and it's going to impact the little children's lives. The other thing we're doing, and I promised Marilyn that I would get with her before Christmas this year, is Mark Cousins has a good program in Weld County that I was at a meeting, and he's like, we have a lot of high-risk kids, and we need to get them work so they can finish their GED. I'm like, well, we can hire them. We have food and nutrition and housekeeping. So he linked with our HR department, and we finally hired the first one, because we believe if the high-risk students can get employment in a healthy work environment, they're going to achieve their GED, and we're going to have a healthy worker in our community. So Marilyn, that'll be our topic before now and Christmas, I promise. But I'll try to translate, when you hear these good ideas, as employers, what can you do to deepen these practices in your environment? So thank you for that. Next up, we have Larry, and I'll have you do the same. A little bit about the organization and the question, and your conversation around the question.
All right. Well, good morning. I'm going to talk about behavioral health in the workplace. And I've been in this field for over 30 years, so I have a lot of opinions and a lot of experience in how behavioral health impacts the workplace. So starting off with full disclosure, in addition to being the director of North Range Behavioral Health, probably more important to my identity is I'm a social worker. And that means that sometimes I'm a little more on the emotional touchy-feely side. So just kind of a forewarning that I'll try not to make people too uncomfortable, but that's kind of who I am. But in all seriousness, emotional health is just as important as physical health. And we really need to recognize how, or think about how we can identify those issues as employers, as workers, as a community. The mind-body connection is critical to overall health. So I'm excited today to talk about behavioral health. I believe it's something that I appreciate Margot saying a lot of things about behavioral health, actually, because typically in my experience, it's not something we talk about or are very comfortable talking about, and I think that we are moving toward making positive changes in that, which I think is a very helpful and very healthy approach. And what I like to do is give an example of when I tell people that I'm a mental health worker or mental health therapist, the response that I've gotten in the 30 years that I've done this work. And I often wonder if I would have been a physician and they would have said, well, what do you do for a living? And I was a physician, and I kind of wonder what their response would be. I know what my response is. Well, wow, that's cool. That's important work. Here's what I hear almost every time when I tell people that I work at a mental health center. Wow, do I need your help? Or, are you analyzing me right now? And I think, I think that's really indicative of the uncomfortableness that we as a society deal with around behavioral health issues. And when I talk about behavioral health, it's both mental illness and substance use disorders. Topics that we tend to avoid, I think that's changing for the good, which is a very exciting thing. But I think there's a lot of misunderstanding about behavioral health and the treatment and how that impacts people's lives. I believe that ignoring it or making light of it because we're uncomfortable with it is not a healthy approach. So in the workplace, mental illness and substance use disorders are often hidden illnesses. People are not as hesitant to talk to a coworker about the medical procedure that they may be having or that their back has been hurting them. But to say to a coworker, I've been really depressed lately, or I've had some panic attacks, that's not something that people are comfortable talking about. And the reason is because there's an embarrassment with that. There is an uncertainty. If I'm vulnerable by being honest with a coworker about something that I'm going through, how is that going to impact how they think about me? Because unfortunately, physical health is something typically that happens to us. I broke my arm or a person got cancer, but mental illness is more, well, you're depressed and you've been depressed for a long time. Isn't it about time that you pull yourself out of that? So it's a different approach, and I think we need to move to where they're closer together. So 1 in 4 individuals have a diagnosable mental health issue. That's a statistic that we've been using for a long time. When you go beyond that, though, and when you look into the workplace, excuse me, I think it's more than that. I think that all of us experience mental health issues from time to time. I equate it to physical health. Like it's not uncommon to get a cold. I think all of us in this room have experienced depression at one time or another. We certainly have family members who have mental health issues, and we certainly have coworkers who have mental health issues. But it's time that we bring that out into the open. So how do we do that? I think we have to talk about it. I think we have to be open about it. I think we need to encourage people not to be embarrassed to talk about it, and recognize that that's just part of life. So I think of wellness campaigns, and I think those are really positive things that many companies do. We do a wellness campaign at North Range, and things like exercise and counting your steps and eating right, and all of those kinds of things that are kind of focused on physical health. But really, those are good things for emotional health, behavioral health as well. So in a wellness campaign, I think one thing employers could do is focus on these wellness activities, but say this is not just for your physical well-being, but it's also for your emotional, your behavioral health well-being. Another idea that I have, which other people have talked about, it's we require all of our staff to get an annual physical, which I think is a good practice. We don't require our staff to go see a therapist every year. There's a concept known, I didn't come up with it, but it's a good one. It's a checkup from the neck up. And what if we encourage people to go talk to a therapist once a year to see if maybe there are some issues that need to be discussed? One of the things that we do at North Range and many other companies or entities are providing it is mental health first aid. Excuse me. If you haven't heard of mental health first aid, it's an awesome program. It's a day it lasts for a day, and it really takes what they've done with physical health or CPR first aid and take it into the mental health, the behavioral health realm. If you haven't taken the class, please look online at our website or others, because I think that's something that employers could really take advantage of, is sending staff to mental health first aid, because it educates people about behavioral health issues. It helps them be alert to what symptoms are, not only for coworkers, but in their own families. I think it's just a really valuable tool. Mental health first aid is one of the most exciting things that I've seen happen in my career, because it's really bringing the needs of behavioral health to the forefront, and I think that's really important. So we've got to attack the stigma attached with mental illness and substance use disorders. What better place to do that than in the workplace? Bring it out into the open and talk about it. We know that behavioral health illnesses have a negative impact on productivity, upon attendance, those kinds of things. And I think we need to attack the stigma by how we talk about mental illness and substance use, and also how we think about them. So a person can't simply get over depression or anxiety any more than a person can get over a broken arm without medical attention. So I'm really excited about the work that we do with Sunrise on integrated care, because I think it's really important to have access to both physical health care and behavioral health care in the same setting, and we've done some really exciting things with Sunrise around that. So in closing, behavioral health is health. We talk about that at North Range. We are a healthcare organization. It's not a social issue, it's a health issue that requires our attention, our empathy, and understanding. Employees should be encouraged to get help for any health issue, physical or behavioral. Being healthy is good for the person, good for the community, and good for business.
Awesome, thanks Larry. So again, a translator is, I talk all the time to my daughter. She's 14 in a high school, and her risk is high for suicide. So just Sunday night I told her, we have an exercise down. What does that feel like right now? You seem a little bit more bummed out. And so my poor children, Kevin, so I made her Google how many minutes of exercise increases your endorphins. Bless my children. And so that's how serious I'm taking it. And I agree with you, Larry. I think depression is a spectrum. And I told her that. You know what? When I went in college, I shut down. I was a hermit my first year. think that was depressed. And you're looking like that, Em. How can we work together to keep you healthy in your mind so you make good choices? And I do that at work as well. So Julie, again, she's just in my mind and heavy on my heart. She's our ICU director, and yesterday she said, Margot, I've decided to keep asking employees when they're showing up angry or not their best self, just sit with me, tell me what's going on in your life. And what she found was a very broken relationship was happening in her employee's life, and that's why she was on a performance improvement plan. She was so distracted. And so I agree with you, Larry. We have to peel back the stories of the employees that we're serving, especially our physicians. My whole dissertation was on physician burnout, and I think it's gotten worse since 2008 when I did this study. And it was because a physician became addicted to meth, and I missed it. And so if we can create that nurturing environment, Kevin, Marilyn, and I, for our physicians, they're going to give you amazing care in this community, but that's on us. So I appreciate your words of wisdom. So next up is Marilyn. Marilyn, let's do the same, a little bit about your leadership work, the question we assigned, and have a conversation around the question.
Great. Thank you, Margot. Good morning. Well, I don't know about you guys, but the time change, I'm a morning person, and so it's about 3:45 when I'm waking up right now and moving. I usually get up at 4:45, and so by about 9 o'clock in the morning, you're thinking, my day's half over. And here I am. And so I'm in that mode this morning. So several of you who I visited with this morning, it's that energy piece of now I have to kind of contain it and just kind of keep moving, right? So thank you for allowing me the time to visit with you a little bit this morning. It's always fun when we pull the community together and really about the partnerships. And when I look at the Weld Summit, it's about the partnerships. It's about celebrating our existing partnerships. It's about creating new partnerships, networking, and how do we make our community the best. And I think Weld County is really on that road. UC Health is committed to the community. We are a growing business, organization, healthcare system. As many of you have seen, we have the new Greeley Hospital going up out on Highway 34. I normally wouldn't do a little infomercial, but I think I had 20 people ask me this morning, when is it opening? And so our first patient day will be first quarter of 2019. Our medical office building, which is also on that campus, will be later next year. And so there's a lot of activity happening. But what I would like to say, it's not all about the campuses, it's not about the buildings, it's about the people and the partnerships. Our mission at UC Health is we improve lives. It's a little bit longer mission, so I'm going to leave it at we improve lives. But really, when we talk about community health and what we're doing, that's our goal. At our core is really our vision, and I think you've heard it consistently with both Janine and Larry and Margot, is it's healthcare to health. It's great to have hospitals and beds. It's great to have sick care, so we take care of you when you're worst. But it's really about how do we go to health, not health care. And so our goal is to work with the communities, partner with the existing not-for-profits, faith communities, businesses, and how do we work together to create the health. I'm with Larry. I'm kind of not even going off my notes because I think it's just evolving. It's really about the total person. It's the mind, body, spirit. It's about how do we show up every day. You can have the physical aches and pains, and I don't know about you, but I think I say at least weekly, man, aging is hard. You get out of bed and the feet hit the floor and you think, what did I do yesterday that made me sore? I mean, it's just that ongoing piece, but we really have to tie it together with the emotional and mental health as well. And that's the partnerships that I think are fun when we really start looking at improving lives. There's a lot of programming that we do, and I want to highlight a couple of them because I think it's key when we start looking. It's not about the physical nature. It's really about the social nature. One of our programs is our Aspen Club. It's a senior program that we get to do with seniors to do medical screening, wellness screenings, mental health screenings. They also work with us in regards to social. It's how do we get them into the community? When you think about your employees and you talk to them about how their weekend was, that's usually a really good indicator about where they are in their spectrum of health. Whether it is, I'm exhausted, I was a weekend warrior, I had so much fun, I connected with old friends, to I needed a weekend just to rejuvenate and read a book. But when that starts becoming the norm where there's not the social component, that tells you that there are some pieces going on. Now, I'm not an introvert, so you won't hear me talk about staying at home and reading a book very often. But knowing that there are the implications of those people that are also going out and doing risky behavior. They're out with 20 people every Friday and Saturday night, and they come back in Monday morning and they are worn out because they haven't taken the time to really say, where is my health? Have I worked out? What's the physical being? What's my mental state? We also have early childhood, and I think this is a theme of focus today. And Janine talked about it quite extensively, but our programs in the school district and the partnership with the school district are key. We have a Healthy Kids Club as well as a Healthy Hearts program. I tell this story, Kevin's sitting here, and his daughter, this is not the only person I've heard it from. In under 2 of our programs, the kids learn what a healthy plate looks like. And when I think about I'm from Wyoming, and I think Greeley's very similar. We like a piece of meat, we like our potato, maybe a little bit of veggie and a roll, right? And what we're teaching the kids today is that's not a balanced diet anymore. That is the old-fashioned diet. And so it's how do we make sure that the vegetables get on there? And Kevin tells the story about his daughter who came home and they were sitting and eating dinner and the plate didn't look quite right. It didn't have enough color on it. That's where it has to start. It has to start with the kids. We have to start making the changes at a place where it's impact. When we talk about community impact, one of the statements that I heard loud and clear with United Way in particular is kids at the 3rd grade reading level and in 3rd grade have a higher percentage chance of graduating. If they are not at the reading level by 3rd grade, their chance goes down. The school district can almost pick out who doesn't graduate. And they said, by 3rd grade, you're learning to read, and after 3rd grade, you're reading to learn. And that becomes a component within our programming as well. We do the continuum. It's the maternal fetal health pieces where we work with organizations. My full disclosure, I'm on Mitzi's Sunrise Community Health Board. I'm fascinated every time we partner in looking at how do we make sure that we're bringing babies into the world healthy. Those are components that make or break us. The next step is the school-age kids. How do we know that we're raising healthy kids? How do you have the conversation with your child and say, you're really kind of having a rough day. How do we move that? And then when we think about our adolescents and high schoolers, and I always say, it's a good thing we didn't have phones with cameras on them when I was in high school. I don't know that I'd be employed, and I think, okay, now all the kids are posting, and I think about the bullying that goes with that and what comes down from a whole component of health today. And then our seniors, and my heart truly aches for our seniors. How many of them don't get out? I think one of my questions is, or my question, which I've started addressing, but I'll get a little more focused here, is how could companies and business join us and others on the panel in creating thriving communities and a vital economy in northern Colorado? It really is about you as the businesses, as the industry. It's not about the healthcare that sits and provides. I will tell you, we have world-class healthcare in Colorado, northern Colorado. We talk about this frequently between Banner and UC Health. You have more technology, quality, safety than most communities, than probably 98% of the communities in the United States. And we have it in northern Colorado. It's really about how do we take the partnerships and create it broader in our communities. A couple pieces that I would tell you from a business perspective is reduce costs and increase eligibility for employees to obtain comprehensive health. As Mark said, more Weld County residents are insured today than we've ever had. That's a key piece. Providing employee wellness opportunities, providing incentives for healthy food options, enforcing tobacco-free policies, support workplace breastfeeding. It's the little things that we don't think about, but it's the convenience that our employees need. It's seeking health at the right place, with the right provider, at the right time, at the right cost. And I think that's the mantra that we have to have from a healthcare perspective, is making sure you have access to that. It doesn't have to be in a healthcare facility, but it is partnering with the knowledge that comes with the healthcare. I would tell you, addressing transportation barriers. This is a whole component that I think we forget, and as businesses, I can't tell you how many of your employees struggle to get to work every day. We have employees that say, you know, I carpool with 5 or 6 people. We can't afford gas. They're entry-level people. How do we help them with transportation? How do we make sure that they can get here? And then support wellness services at your work sites. People love wellness services. Tie the mental health, emotional health, and the spiritual well-being into it. Don't have them do exercise. It's really about the whole being. If you feel good about yourself and you feel good about the day, that pain that you had when your feet hit the ground goes away. Thank you.
Thanks, Marilyn. And if you ever want to study a model that is outcome-based, I think Healthy Kids Club has been in place for 20 years. And Colette's here, and Marilyn can talk, but it's a program that has measured success. So that's a model that I'm familiar with, and that's what I love about UCH's work, is putting in programs that have outcome impact. And I'll just double back around to your senior club, Aspen Club. I'm on the Alzheimer board. My mom died of dementia, and socialization is an intervention that would help. It won't get rid of dementia or Alzheimer, but your work in the Aspen Club, again, on the socialization, the holistic piece of health, is what, when you go back to your work settings, remember those words: holistic, socialization, asking the questions, and then measuring the outcomes. So thanks, Marilyn. All right, Mitzi, you get to round us off. We'll go with the same format, a little bit about you and your organization and the question that we had asked you, and then a good conversation.
Okay, excellent. Well, is this working? You guys hear me? Okay. Well, thank you. And I couldn't be more honored to be on the panel with this group. Marilyn serves on our board. Larry is a key partner with Sunrise. Janine's a key partner with Sunrise. Mark is our chair of our board. Margot and Banner are key partners with Sunrise. I mean, I couldn't be with a more esteemed group and more important to Sunrise and our mission. But even on a personal level, I've watched all of them give of their time and their energy, even to Marilyn, who personally delivers meals to people that she knows is struggling with homelessness. So you have a wonderful panel here to ask questions and to engage with. So it's just an honor to be here. A little bit about Sunrise, because I'm not sure everyone here knows about Sunrise. We are a federally qualified health center. Our mission is to provide affordable access, quality care for all. We will see everyone. You come to our front desk and say, hey, I have Blue Cross Blue Shield insurance, could I make an appointment? Sure. Hey, I have no insurance, could I make an appointment? Sure. So your insurance status does not open or close a gate when you come to Sunrise. Now, we don't actively recruit and reach out to people who have private insurance. There's lots of resources for them. But we are actively reaching for people who have no insurance or who are underinsured. I have insurance, but I have a $10,000 deductible. I have medical, but I don't have dental. That's the population we want to serve. And our model is really a three-legged stool. Picture it. One leg is medical, one leg is dental, and one leg is behavioral health. If any one of those legs is too short or skinny, that stool is not very stable. So our healthcare system doesn't fund those legs equally or even from the same pots. But our job is when people walk in, we put that all together behind the scenes so they can have affordable access to medical, dental, and behavioral health care. We can't do that without the partnerships that are represented. And I'm going to come back to those partnerships in a minute. We served 38,000 people last year. 85% of them lived at the poverty level or less. So that's a family of 4 making about $24,000 a year. Those people are struggling every week. How do I pay rent? How can I buy food? How can I fix the car? How can I get my diabetic medication? My daughter really wants to play soccer. It's good for her to play soccer. You know what, this week I feel pretty good, so I'm not gonna buy my diabetic medication. I'm gonna put that money towards food or rent or the car or her soccer. That's who we serve. Historically, federally qualified health centers, I think, have been considered the safety net or the clinic of last resort. And we, first of all, find that a little bit insulting, but it also is not reflective of who we are. We are striving to be the clinic of choice for our patients. To believe that they, even when they're living at that kind of economic level, that they don't have choices is not accurate. They could choose to go to the ED. They could choose to not access care at all. They can choose holistic options. But we're striving to be a clinic of choice for them. And again, that 3-legged stool, medical, dental, and behavioral health. So we have over 400 employees now. We have 10 locations. And we provide family medicine and pediatric medical care, all ages dental care, and through our partnership with North Range, all ages behavioral health care. But one of the things that we are doing, in addition to trying to get people access to health care, is we are trying hard to look at that greater social determinants of health. Everything everybody has said is absolutely true. The people who live right next to our largest clinic down in Evans, if they're struggling with food insecurity, housing insecurity, transportation insecurity, what we do to help them with their health around diabetic care isn't going to make a difference if those things can't get resolved for that family. So one of the things that I thought I'd talk about is our educational efforts to try to improve the health of individuals and the community. Because we're family medicine, we want to care for you from cradle to grave. Our employees are on that same trajectory, though. So we have to be part of training the next generation of healthcare providers. So last year, I think we had something like 181 students that we offered over 120,000 hours of education to. It is students from medical assistants to dental assistants to nutritionists to social work, pharmacy, dental interns, physician interns. We have a partnership with North Colorado Family Medicine Residency Program where they have 9 openings every year for their first-year resident. 2 of those openings are assigned to Sunrise, and people apply for them, and then we get to match, and we have that physician then with us for 3 years training. So we have a robust program. But one of the pieces of that program that I like the most is what we're doing with high school students. And it echoes some of what you guys have talked about of getting people linked to jobs, getting linked to education. Because if you define health even broader than medical, dental, and behavioral health, and you define socioeconomic health, if we can get kids connected to a job that will help them, and maybe individually, but may help their family break the cycle of poverty. So it first started when my oldest son started at University High School. He's now a graduate from CSU. So this is quite a while ago. But I realized that university had 4 paths for their students. They could choose health, liberal, just like liberal arts, science, math, technology, engineering, and healthcare. Yeah, healthcare, business. Business was the other one. And those paths, those students were required to do 50 hours of community service, 50 hours of an internship, 12 hours of job shadowing. And I looked at that health path and I thought, where are those kids getting that internship and that job shadowing? What's happening? And the school said, well, if they know somebody, they just get connected. And I thought, okay, I can picture me at 16 years old calling my pediatrician's office and saying, hey, can I come and job shadow? And I follow my pediatrician around for 4 hours, and I get done and think, oh my God, those kids screamed all day. There is no way I want to do that job. And I turned completely away from healthcare. And I thought, oh, we got to give them more exposure. So we've set up a program where the 50-hour internship, we have them come and take 2 hours in every discipline we have. 2 hours in lab, 2 hours in x-ray, 2 hours in with a social worker, 2 hours with a diabetic educator, 2 hours on our mobile health van that goes out to the migrant camps and homeless shelters, 2 hours with the dentist, 2 hours with the medical assistant, 2 hours with me if they're interested. Now, by the way, nobody ever picks up on that. They don't want that. They want to get in where the action is. So, but we try to have them see all of that because the idea is to give them exposure to everything that, even IT, 2 hours with IT. So they have exposure to what's happening in healthcare because hopefully that'll spur interest. Hopefully that will make them see, hey, that person looks like me. Hey, that person came from the same background I have. Hey, I could maybe do that job. Now, it's a ton of resources on our part, right? And we do our employee orientation, and I tee it up. You will at some point have a student with you. And I do know that that slows things down. And I know that it can be a hassle on your busiest day. But please step back, take a deep breath, and embrace that you are helping to create the next generation of workforce that may care for you or your grandchildren. So I don't know what the ROI on this is, right? I suppose we could stalk these kids on Facebook and find out where they end up, but that's creepy and we don't have time. But it is the right thing to do. Here's the other thing it does. It inspires our workforce. They really like this teaching part. So I encourage you to think about this element in your environment of how can we take the expertise we have and share it with the next generation that will help them as an individual and may end up helping our community. Thanks.
Nice. Thanks, Mitzi. So just to sync it up, I appreciated your comments, like as employers, what could we do to open our doors, like Mitzi said, to inspire the up-and-coming work generation to love our work so they follow a track that would get them employed. I think that was awesome. And I appreciate our partnership with Sunrise. We probably need 5 more clinics. Colorado Hospital Association just released a transparency report, and Banner is the safety net provider in Northern Colorado. And we appreciate the work you do, because without Sunrise, we have a margin. It would look very different without our help, and more important than margin, the health of our community would not be healthy. So I really, really appreciate Sunrise work, and if you ever want to be motivated on what a caring work environment and a caring health environment looks like, tour. Because that was probably my biggest delight early on in Colorado, was to meet with Mitzi, tour, and see the amazing environment that vulnerable people come into and feel cared for and cared about. So you've mastered it, my friend. Well done. So with that, we have some time, Dr. Wells, for questions?
We do. We have time for some questions. We want to sort of have your reaction. This is about where did you hear? What's your vision? Where do you want to see things go? We're talking a lot about where we are today and our vision, but we're going to have folks run mics around. You can ask a question to a panelist or to Margot, or you can make a comment that we might benefit from hearing where you see us going in the work ahead of us so that we can continue to thrive in Northern Colorado.
Thank you all so much for talking about kids. I work for District 6, so, and thank you all who worked so hard on 3A. We really appreciate it. I wanted to know, I'm working directly with a lot of those kids that we talked about, and a lot of them are getting really excited about things like nutrition and activity, and we're using the Fit Sticks in the classrooms, and we're doing things like, my kids love dancing. They love dancing in the classrooms. So how do we continue to bring that work outside of the classrooms? The barrier that I'm personally seeing is it stops in the classroom, outside of the classroom in the home. So their families and their parents are not keeping up the work that we're doing in the classroom, and that's where we're not seeing it. So how can we take the work we're really pushing in the classroom and spread it outside of the classroom into those homes and with their families?
I'll give you one idea, and then you all just jump in. There's a social model called positive deviance. So how I'd frame it is, if during parent conferences you could see a family that is high risk, that has mastered it at home, learn what they're doing, and then have them teach back to other parents. Because sometimes what I tend to do as a leader is, I can figure this out, and I'm going to tell you what to do. Positive deviance is a social model that comes from within. They studied cultures that had positive deviance in their culture, that had overcome all the different social deterrents against all odds, figured it out, and then they taught their community. So I would look at that framework, and at parent-teacher conferences, look for your high-risk families that actually are doing it at home, and raise them up as a best practice, and ask if they'd be comfortable to even mentor 2 more families. Like, how have you figured out to take the healthy work here to home and celebrate them and have them do the teach back, versus me, who is blessed, trying to help figure that one out. So that would be my first reaction. Any other thoughts, you guys?
So I don't want to keep pushing the early, but, I think it does start. At United Way, we've had the privilege to be a part of several different programs that are reaching out to parents very early. Bright by 3 and Best Start for Babies and the Hippie program and under North Range and things like that. And I really think, like you say, what we find in all of those programs is that parents are eager to learn. They'll say, I didn't know. I thought I could wait until they get to school. I didn't know what it took. And so, but we've also learned that then when we have strength with a group of parents, turn them into mentors. Have them be able to share that, which, picks up on that. But I just can't stress enough that reaching out to parents early and supporting them and helping them, and not just waiting until the children are in 5th grade. Because then, life is a little bit too overwhelming with a 5th, 6th, 7th, 8th grader. And so I think we have to start early.
I think there's also a bigger question around the social acceptance of being silly. And I think there's a serious piece. And when you talk about even families, number one, taking the time, how many people are willing to be silly? And I think that's the piece of that social acceptance. We talk about the taboo behind mental health, and we talk about, but there's still a social piece. I mean, I remember when I was a kid, my parents were crazy. I mean, we had more fun doing silly things. And I think about dancing, somebody's so self-conscious when the parent and adult is so self-conscious about dancing. Doesn't that do some confidence for the kid as well, of saying, well, if they're looking at them and they're making fun of them, then I'm going to get made fun of. And I think we as business leaders really have to help our teams be confident in that. I think adding some of that, I will tell you, Mitzi does a really nice job adding some of that, like at her whole employee staff meetings. There's those pieces as businesses. I think we do it, it's the laughing, it's the being able to have some fun, and it's okay if you look silly. That's not the word that typically get used, because it turns into more of a bullying of, what are you doing that for? You look stupid. So how do we change our vernacular? How do we also lead from a positive perspective with our employees who also transfers home? I think there's a whole component from a social issue.
Marilyn, I love that idea. So this is why I have to have lunch with her. So what I would think is, assign homework. You need to dance with your parent tonight. And you're going to report back, what song did you dance to and for how long? How fun would that be? So again, I feel like I'm telling you what to do. I think you got to come from within. But one structure might be assigning silly homework. How fun would that be? That's why Marilyn and I are going to have lunch together, because we're going to feed off each other.
I want to go to that lunch.
I know, right?
Yeah.
Awesome. Other questions? And was that helpful? Okay. Yeah.
And not looking, I haven't looked at the actual survey questions. I don't know if those are actually on the website. But one of the things, I'm with the Community Grief Center. We're a fairly new nonprofit. We're only 14 months old. But one of the things that we know in our work is that loss from a death can very much trigger depression, risky behaviors. Was grief looked at as one of the factors? Was that a question in, what contributed to your depression or mental well-being? Because grief is certainly a trigger.
Great question. Do you want to do that one?
It is a great question, and our data expert, I don't see Cindy here to have her actually answer it. She knows the data book better than any of us. The results are going to be talked about more in some later sessions. They are on the website as well. I'm not sure that we specifically looked at grief as a cause. We did ask people to disclose if they have depression, anxiety, and different conditions, but I don't think we took it to that next level. So we'll feed that back into our data folks and look at that a little more as we move forward. So I can't answer your question specifically.
Okay. We'd like to be a part of that if, in the future. I think that's important work.
Yeah, and we welcome that. One of the things we want to be sure we do is that as we come to asking for our community to help us understand where they are at and what they're feeling and experiencing, we want to be sure that we've got folks around who can help us frame those kinds of questions that are important. And so we'll get you connected so that we don't lose sight of that.
Well, and as employers, so tell me your name again,
Melissa Jensen,
and what organization?
Community Grief Center.
So Sarah, my colleague, let's have her come to Banner Health, because I lost both my parents, and my tolerance for life was nothing, and I left my job because of it. I'm like, I'm done with you people, out. Because you're so tired, and it becomes so real how short your life is left, that am I making meaningful work? So I left St. Joe's. I'm like, peace out. You guys are crazy. And it was after my dad died. And so when I hear a physician or volunteer or employee has lost someone and they just come back like they are, I'm curious about that, actually. So I think, Sarah, we need to bring you in as top of mind awareness that you guys, look at our average age in this room. I wonder how many of us are covering that up and how that's impacting our best self. So thank you for bringing that up, and look at the resource she just gave us for all of your employees to uncover that part of our story. Thank you.
My name's Larry McDermott. I'm the director of the Arco County. We serve families, or an advocacy program that serves families that have children and adults with disabilities. One of the things that we've been working on for the last 10 or 12 years is respite. And we felt like for our population, we have many families that have high needs children that have behavioral difficulties, perhaps have autism, run from the home, all those kinds of high risk behaviors. And really from a preventative side, one of the things that really they needed most, and that was preventing things like stress in the home, depression, all those kinds of things, was respite. So I guess I just want to kind of throw that into the mix this morning, is that we've been working somewhat in a vacuum, and we really want to make this a community issue. It's not just about people with disabilities, it's about mental health issues, it's about elderly. We're all going to need, we're a caregiver, or we will be a caregiver at some point. And the stress, I think we always just kind of say we can buck it up, right? We can just suck it up and deal with it. But the reality is that it does take time. You have to refuel yourself, and you have to take care of yourself. So I think that we're really trying to move that from just the population I serve to the whole community. So we'd like to invite other groups. We run a group for Northern Colorado Respite Coalition, and we'd like to just open that up because it should be a community issue, not just a developmental disability issue. Thank you for your time doing this morning. This is awesome. And also, thank you to District 6. I'm excited about that. So.
Awesome. Again, thanks for that resource for our community.
Yeah, thanks, Larry. And respite is a very broad topic, but I just want to make sure everyone in the room knows about the respite services that we offer through the crisis program at North Range Behavioral Health. A few years back, the state funded crisis services at a higher level to provide 24/7 crisis for people with experiencing behavioral health issues. And so we do have a 24/7 respite available through our crisis center. So if you don't know about that and you'd like more information about it, please contact us. It's a little bit different than the respite I think Larry's talking about, which is more of a preventative. This is more of a crisis respite, but it's a really powerful program. The one thing that is very exciting about that is we run that program with what we call peer specialists. So staff who have life experiences dealing with mental health and substance use disorders, and it's a very effective program.
All right, well, I want to ask if you could join me in thanking our speaker, Margot Karsten, and the panel for sharing their ideas and what's going on in their organizations and what they see us as being able to bring to bear on all this collective work that we're going to do together. So please, let's thank them for being here and starting our morning off. I just got back from a national conference. It was interesting. Some of my team was really a little worried that I traveled the day before this conference and wasn't going to get in until late last night. They were thinking, what's going to happen if you don't get back? And I'm like, well, it's not about me. It's about everybody else. So you would all do just fine. But what was exciting about this conference is it laid out around the country what our challenge is. You know, these conferences like to talk about what are we faced with chronic disease and what's happening with all of the mental illness and all of the substance use that's going on in the country. And we can't ignore that, and we're not trying to ignore that in any of the conversations that we're having here today and that we're going to continue to have. But I will tell you that one of the most exciting parts about what I got to be engaged in is that communities that are doing what we're doing, communities that are getting together, communities that are bringing lots of people to the table, that are recognizing how everything touches everything else, that reading at 3rd grade means you're more likely to reach health and stay healthy for the rest of your life, that those interconnections in the communities that are working on it the way we're doing here in Northern Colorado, that have the resources, we've invested really wisely here between the private enterprises and the public enterprises. We're the kind of communities that they're now beginning to show evidence that it's going to make a difference. And what we want to be sure we're doing is moving from data we're going to continue to share into this kind of conversation and then into action, because we're going to be the communities that are going to stand out in the nation. There's some research that's beginning to show this now, that that's what's leading to not only healthy communities, but without health you can't thrive. And if you can't thrive, it doesn't really matter what your businesses are doing. The economy won't actually achieve what it has the potential to do, and we want to be that place in Colorado. We're going to double in population here really quickly. We're going to take over the Denver metro area. And we've got productivity already up here that we want to leverage. So I want us all to continue this conversation. So we really are grateful to the folks who got us started here today. We're going to do a little bit of standing up and getting some stretch going, and then we got to move out of this room because we got to get rid of all these dirty dishes so that we can come back and sit in a room that's got the tables cleared. But because we're about health, we need you to stand up, and we need to have Aaron get us moving a little bit.
Good morning, everybody. So we're just going to do about 4 or 5 minutes of stretches. So to start, we're just going to reach up. This is kind of hard with the microphone. So reach up for the ceiling, big stretch, and then you're just going to tick-tock side to side. About 10 times. All right. Okay, arms come down, shoulder roll forward. Side to side. Great job. A few more. All right, hold it one side, looking over that shoulder. Feet stay forward. Switch. All right. Now we're going to our neck, so just neck stretch. Round and around. Other way. All right, let's get the legs loosened up. So just march in place, bringing your knees about up to your belly button. All right. Now, if you need to use your chair for balance on this one, we're just going to swing our foot back and forth, loosening up that hip flexor. Switch legs. Great job. All right, now we're gonna bend over and touch our toes, stretching out our hamstrings. Trying to keep those legs straight. Big stretch. Slowly, you're gonna round it up. Big stretch back up. Great job, everybody.